Hi, hope you guys are all doing fantastic. Welcome to our YouTube channel. In this video, we'll focus on a topic which is considered to be one of the most leading causes of blindness, especially in developed world and even in developing countries like India, in metropolitan cities where the rates of diabetes mellitus is very much rampant. We'll find this condition, diabetic retinopathy, will be the focus of this video as per the schedule mentioned previously. And we'll have an image-based discussion, right? That's the reason why I'm utilizing this space. And I've oriented myself so that I can utilize this space for projecting the images. If you remember a couple of weeks prior while discussing hypertension, I mentioned about something called as hypertensive retinopathy, in which we have seen various changes at various grade levels. Like in grade 1, we have seen silver wiring appearance, where there is arteriolar thickening, tortuosity, and increased reflectiveness. Grade 2, we have seen the nipping or constriction of veins at the level of arteries, that is arteriovenous nipping. Grade 3, we have seen different shapes of hemorrhages in the table, as mentioned in Davidson, that is flame-shaped hemorrhages, blot-shaped hemorrhages, cotton wool exudates. And in grade 4, along with the previously mentioned changes, there can be papilledema, so on and so forth, right? So in this video, we'll see what exactly is diabetic retinopathy all about, why is it happening, what are the various causes, and various categories in diabetic retinopathy, as it's a progressive condition, and how to manage it. And also we'll look into some risk factors. And most importantly, at the end of this video, we'll have projection of various images and we'll discuss those images for your better understanding, right? So I hope you guys are ready. Let's go ahead. So first and foremost, as you know, diabetic retinopathy is one of the leading causes of blindness, and it is a microvascular complication of diabetes mellitus. And why is it happening? It's all because of hyperglycemia, which is the culprit. Hyperglycemia leads to increased glucose, availability of glucose in retinal blood. As a consequence, there is increased metabolism, including increased alternative pathways of metabolism like polyol pathway, which leads to formation of sorbitol. And this sorbitol gets accumulated within the cells and it doesn't go out because it is impermeable, leading to osmotic damage of the cells. So which cells are we talking about now? We're talking about vascular endothelial cells because this condition affects the microvasculature. So because of hyperglycemia leading to damage of vascular endothelial cells, eventually what's happening is there is disruption of the homeostasis that's present there, disruption of vascular autoregulation, the terms which are mentioned in Davidson. And because of this disruption, there is chronic retinal hypoxia, and this leads to some compensatory changes. When there is hypoxia, your body needs, your retina needs oxygen, right? So there is stimulation of production of various growth factors, various cytokines leading to new blood vessel formation, which is neovascularization. However, neovascularization again leads to series of other complications because the new blood vessels that are formed, they're not perfect. Like there is leaking of blood because the blood vessels are not matured, and because of this leaking, there can be hemorrhages, right? And also because of weakening of these endothelial cells, there can be aneurysms, there can be edema formation, etc., etc. Oh, nice. It started drizzling. Let me continue in this drizzle itself. So this is why we see what we see in diabetic retinopathy. It can be microaneurysms because of weakening of the wall. It can be hemorrhages, blot-shaped, dot-shaped, flame-shaped, cotton wool exudates, edema, scarring. All the sequelae are happening because of this. And most importantly, this diabetic retinopathy is a progressive condition. So the changes have been categorized into non-proliferative, pre-proliferative, and proliferative. In case of non-proliferative, you see there's microaneurysms, hemorrhages, which are termed as dot and blot hemorrhages. Whereas in case of pre-proliferative, you see changes such as venous beading, cotton wool exudates, and intraretinal microvascular abnormalities like spider vessels, etc., which we'll show a bit later. And in proliferative retinopathy, you can actually see a proliferation of various blood vessels, formation of various new blood vessels, neovascularization, hence it's called as proliferative stage. And eventually this leads to hemorrhages because the blood vessels which are formed are leaky. So vitreous hemorrhage, which leads to sudden loss of vision. And eventually these new blood vessels get scarred. There can be gliosis, scarring, and even retinal detachment. So vitreous hemorrhage as well as retinal detachment, these can cause sudden loss of vision. My mom had seen or experienced it personally. She had vitreous hemorrhage on her right eye. There is sudden loss of vision. The eyeball started getting reddened and there was bleeding. That was very panicky kind of experience that I had during pandemic time, and there was almost every week I used to visit ophthalmologist, take my mom, and she suffered a lot in the process, all because of hyperglycemia and its sequelae. So these are some of the changes, and these are some of the categories, right? Non-proliferative, pre-proliferative, and proliferative. There is something called a CSMO, that is clinically significant macular edema, because this is very much important as it is the leading cause of blindness in diabetic patients. So what is the CSMO? So macular edema, so what are changes we discuss? Microaneurysms or hemorrhages. If these changes are happening in the periphery of retina, that's fine, but there is no associated disturbance of vision. However, if these changes are happening near the macula, the central vision area, then there can be loss of visual acuity. So when you have this fundoscopic examination, when you see these changes like microaneurysms or hemorrhages or exudates such as cholesterol deposits, etc., and along with that, if patient has complaints of loss of visual acuity, you should suspect CSMO, clinically significant macular edema. And this is, as I said, is a leading cause of blindness in diabetic patients. And its diagnosis is confirmed by slit lamp retinal biomicroscopic examination. And also, along with that, I also wanted to highlight one more term which is mentioned in Davidson, that is Rubiosis Iridis, where the new vessels that are formed, if they form on the anterior surface of iris, it leads to this condition called Rubiosis Iridis, where these new blood vessels, new vascularization that's happening, blocks the dryness angle of the eye, leading to secondary glaucoma, right? So these are some of the changes which I wanted to highlight. And what are the various risk factors? As you can see in the table that's mentioned in Davidson, no poor control of sugar levels, poor glycemic control, long-standing diabetic patients, obesity, pregnancy, smoking, hypertension, dyslipidemia, all of these are constitutive risk factors. And coming to management in brief, there are some intravitreal injections. My mom had taken an injection in her eye, intravitreal injection. So these are nothing but some monoclonal antibodies which are known to be anti-angiogenic, right? So, for example, ranizumab, it's one of the monoclonal antibodies which can be delivered inside the eye directly, intravitreal injections, especially to address macular edema, to treat macular edema. Also, there is another therapy called photocoagulation where you can use lasers, argon laser, for example, in order to eliminate scar tissues or to remove the zones which are showing ischemia, retinal ischemia, or to seal the blood vessels, the leaky blood vessels, and also to reduce the edematic changes, especially macular edema, right? In fact, photocoagulation is known to be very effective in cases, as you can see here, which has been picked from Davidson, this piece of information. So having said that, the objective of this video is to briefly give you an overview of various dimensions of diabetic retinopathy. Now let's get into the core where we'll project images and simultaneously we'll discuss what these images are all about, right? Let's go ahead. So I got my notes and simultaneously as I'll be projecting the images, we'll highlight certain important points. So in the first image, as you can see, discrete red dots, these are nothing but microaneurysms. Aneurysm is nothing but ballooning of the vessel wall because of its weakening. And why does weakening happen? As we discussed previously. So microaneurysms appear as discrete red dots and these are narrower than the vessels if you carefully observe, isn't it? And in the next image, as you can see, These areas are nothing but hemorrhages which are wider than the vessels, right? And these hemorrhages, you can see irregular margins, and these are obviously larger than the microaneurysms, right? And in the following illustration, you can see exudates. These whitish highlighted areas, you can see these black arrows, right? Focusing on this area. So these are nothing but your cholesterol deposits. Because of leaking blood vessels, there can be even cholesterol deposits, fat deposition, right? So irregular lesions, which are formed from leaking of cholesterol. And the white arrow represents edema of macula, which can lead to blindness, as we discussed previously. And in the following illustration, you can see these white fluffy areas, which are nothing but cotton wool spots. It's really good. Climate today is really good. Just 20 minutes ago, it was very hot. And in fact, my camera also got stuck because of the temperature. And all of a sudden, it started raining and, started becoming cool. Wow. Awesome. I hope you can really appreciate this as well. So as you can see, these are called as cotton wool spots, white fluffy lesions. And these are specifically seen in rapidly advancing retinopathy cases or even in cases of hypertensive retinopathy. And in this following illustration, you can see venous bulging of the walls, giving a beading appearance, right? Venous beading. So saccular bulges in the vein walls, as you can see highlighted by the black arrows. And the white arrow shows spidery vessels, IRMA. There is intraretinal microvascular abnormalities, which we discussed in pre-proliferative stage, right? So spidery vessels. And in the following illustrations, you can see tufts of structures which are arranged as tufts. Right? These are nothing but your new blood vessels, neovascularization. So fine tufts of vessels on the retinal surface. And you know what? If left untreated, like these can turn into scars, eventually leading to retinal detachment, leading to blindness ultimately, right? So neovascularization. And in this particular illustration, you can see what my mom had experienced, vitreous hemorrhage, which leads to sudden loss of vision, a panicky kind of situation. This is because of the new blood vessels that are formed, they are leaky in nature, can lead to blood accumulation within the vitreous chamber, right? So hemorrhage due to rupture of new blood vessels, vitreous hemorrhage, which can lead to sudden loss of vision, right? So these are some of the images which I wanted to highlight. And along with that, I found some other beautiful illustrations and images. These are all, in fact, fundoscopic examination, right? They're not drawn by hand or they're not graphic illustrations, but they are actual fundoscopic views which you can notice in diabetic patients when you observe their retina. So all of the images which are projected here are fundoscopic examinations, right? So to summarize all that we have discussed so far before we conclude, as I said previously, this diabetic retinopathy is a microvascular complication of diabetes mellitus, and there's one of the leading causes of blindness, especially in developed world, even in developing countries like India, in metropolitan cities or in areas where there is rampant, incidence and prevalence of diabetes mellitus. These changes are quite obvious. We cannot say that only urban people are suffering now. This is spreading. Diabetes is even spreading to rural areas because lifestyle changes, everyone is being affected in one way or the other in a negative manner. So, as we discussed, hyperglycemia is a culprit which leads to series of metabolic changes, leading to altered vascular autoregulation, as a consequence of which there is damage to blood vessels. For the new vessels which are formed are not functional to such an extent that they lead to leakage, they can lead to hemorrhages, there can be aneurysms, there can be edema formation, scarring, etc., etc. Right? And we've seen the categorization of these changes into non-proliferative, pre-proliferative, and proliferative changes. We have seen what CSMO is all about and how there can be loss of visual acuity, even sudden loss of vision, along with some risk factors, management, and in the process, we even discussed about Rubiosis Iridis, which can lead to glaucoma, right? And finally, we have seen some illustrations and tried to highlight the changes which we discussed previously, like microaneurysms, like hemorrhages, hard exudates, edema, and vitreous hemorrhage also we've seen in the last illustration, so on and so forth, right? So once you go through theory and simultaneously correlate with the images, which I keep highlighting in almost every video, it makes the process even more fun, the process of learning even more fun and joyous. And along with that, in most of our families, we have diabetics, right? It can be our parents, it can be our relatives, it can be self, so on and so forth. So understanding these changes is very much important so that regular checkups can be done. We can take care of self, we can take care of our own family members, and most importantly, we can take care of our patients as well, right? Because if neglected, if left untreated, as I discussed, this is a progressive condition which can lead to partial or complete loss of vision, which is very unfortunate, right? So I hope this discussion is helpful. And if you have any further queries, you need any further assistance, you can always get back to mail at proudtobedentist@gmail.com 24/7. It was fun and it was really awesome interacting with you, partly because of the climatic changes as well, and largely because of the fact that I'm doing what I love. So the point is, do what you love what you do. Life becomes much more peaceful, fulfilled, and satisfactory, right? So wish you all the best. Love you all.